Welcome to the second video in the DIY series. After completing the first video, you should be getting a feel for the type of continence or pelvic floor problem you're experiencing, and now we need to do some detective work before deciding on the best treatment plan. Let's start by looking at bladder behaviour, and the best way to do this is by completing a 3-day bladder diary. A diary enables you to investigate how much urine your bladder can hold, how long you can last between trips to the toilet, how many leaks you have each day, and your level of urgency. Now, it's really tempting to avoid the inconvenience of filling in a bladder diary, but once you've done it, you realise just how helpful it is. A top tip is that it can be very encouraging to complete a before and an after, and even an in-between diary during the DIY programme. Now, what makes your bladder symptoms worse? Everyone has their own set of triggers. When we're ill, tired or stressed, before a period or during a period, getting up from lying down is really common. Coughing, sneezing, running taps, the infamous putting a key in the door, and even cold, wet, windy days can have an effect. A bladder diary will also help you to work out if certain drinks or foods have a sensitising effect. It's very individual. For example, it's been thought for a long time caffeine is an irritant, but there's no real evidence stating that this is true for everyone. The diverse list of irritants includes carbonated drinks, acidic fruits and fruit juices, spicy foods, tomatoes, and even chocolate. Now let's have a look at ways to treat an overactive bladder. The goal is to have a bigger, more chilled out, less sensitive bladder. So how are you going to achieve this? The first step is to make sure enough fluid is passing into your bladder. If you've been drinking small amounts, try and gradually increase your fluid intake to around 2 litres a day. Remember, we said your bladder performs those little mini squeezes on a regular basis to check out its contents. We don't want these to trigger off the big emptying reflexes until we're ready. Let's have a look at different ways to calm a panicking bladder. They're often called deferment techniques. You need to sit firmly on a hard surface so that your undercarriage is well supported. Rise up onto the balls of your feet and do some heel taps. Try and curl your toes downwards if you can, as if you're gripping your socks, and then rub the skin over the base of your back and do a gentle pelvic floor contraction. Check your breathing is calm and steady, and distract your thoughts using any technique that works for you. Leaning forwards and putting pressure on the clitoral area can help too. And then wait, and this is the big challenge. It's really hard, but hang on in there. Your bladder is like a tantruming 2-year-old. Stay calm and don't let it win. Don't be tempted to give up, because if you do that while the urge is there, you'll leak as you run to the toilet. It may take a few minutes, but hang on in there. That urge sensation should fade. Practice, practice, practice until you can drop into the techniques really easily. Success is important, so check out your diary. If you can usually wait about an hour between wees, see if you can ride that first urge desire and last perhaps an hour and 5 minutes. Once the urge is worn off, stand up, move around slowly and empty your bladder calmly in your own time. But don't wait too long until another urge sensation builds. Finally, remember those coping strategies we mentioned earlier, the ones that are feeding your bladder's oversensitivity. Well, they really need to stop. No more just in case wheeze or nipping to the loo for numerous final wheeze before leaving the house, and don't drastically reduce your fluid intake. Some important top tips. If you live with an overactive bladder, your anxiety levels are likely to be raised a lot of the time, and this can affect other areas of your life. Find an activity that helps you relax. Practice mindfulness. On a practical level, anything that you can do to feel in control will really help. So owning a female urinal is helpful, even wearing a pad in situations where you feel you're possibly at risk. If you're not worrying, then you're less likely to need to go. Now, lowered oestrogen levels can affect the quality of tissue in your vagina and your wee tube, which can sometimes make overactive bladder symptoms worse. So sometimes a local application of oestrogen can really help. so seek advice from your doctor if you feel this is relevant for you. You need to be able to fully relax your pelvic floor, and it may be that these muscles are constantly on red alert. Make sure you focus on the pelvic floor techniques of relax and release, and these are explained in the final video of the DIY program. You'll have good days, you'll have bad days, so try not to overanalyze and get really frustrated with every blip. Think of the process as a retraining exercise. Some women notice a difference in 2 weeks, others it can take around 3 months. And definitely don't forget your bowels, constipation, bearing down to empty. It puts a massive strain on your pelvic floor. And also, if your back passage is loaded with a hard, dry stool, it may prevent your bladder emptying fully. What about other treatments that might help an overactive bladder? Well, for many women, bladder training and a few lifestyle changes are all that's required to put them back in control, but others need more support. Now, medication is often offered as a first option, but side effects can include dry mouth and constipation. Now, research is pointed towards a drug-free alternative using a simple treatment that's safe, easy to use and cheap. It's called transcutaneous tibial nerve stimulation, TTNS, and it modulates the bladder's activity using a simple TENS machine and some small adhesive surface electrodes that are placed over the tibial nerve as it winds around your ankle. It can be administered in the comfort of your own home 3 times a week for around 30 minutes, and all you need to do is to take off your socks. So if lifestyle changes aren't delivering the improvement that you'd really hope for, then TTNS may help. The home treatment section of the DIY program will give you all the information that you're going to need. Before you assess your pelvic floor for the first time, take a moment to check your vulva. We self-examine our breasts. It's just as important to know what's normal down below. You're looking for changes in colour or skin condition, and you're feeling for any lumps or bumps. So get comfy, prop yourself up and use a mirror. You need clean hands, no lotions or potions. You're going to start at the top on your pubic bone, move onto the clitoral area and then around the vaginal entrance and the labial folds. Check all the way back to the skin around your bottom hole. Try and get into the habit of doing this check at the same time every month when you do your breast check. So let's start our DIY pelvic floor muscle assessment. Can you engage those deep muscles? Before we begin, let's just go through the movement pattern that you're going to be thinking about. You're going to start with your bum hole. Imagine you're trying to stop yourself breaking wind, and then you'll be tightening your bum hole firmly and then continuing with that tightening movement by adding on the action of trying to stop a wee. And you should feel as if your undercarriage is lifting slightly upwards and forwards. Any movement in this direction means that you're engaging your pelvic floor. And then you let your undercarriage release. You allow the muscles to relax and to soften. So one option is to just look from the outside. You get into that propped up position and you look at the whole area of your vulva. As you activate your pelvic floor muscle, you may see the vulva draw inwards and away from you. Second option is to feel from the outside, and this is possibly the easiest way. Just place 2 fingers over your bottom hole. You'll be feeling the circle of muscles around your anus, and as you tighten, you'll feel your bum hole move away from your finger. The third option is to feel from the inside. So you can gently insert your thumb or finger into your vagina and let your finger bend onto the pelvic floor muscle on the right or left side. As you activate your pelvic floor, you'll feel a lifting movement under your finger. Now this is really important. The movement that you are doing should not feel like a bearing down movement. It shouldn't feel as if you're pushing a baby out or you're forcing out a hard stool. And some women can really struggle with the pelvic floor technique. So if you feel that in an attempt to produce some movement, all you can do is bear down, then stop trying. Continue with the program for some further advice. A quick win. Try sitting or lying because these are really good positions to practice the movement. There's no load of gravity and body weight is reduced. A top tip is to definitely avoid clenching your buttocks, bobbing up and down and breath holding. We'll be looking at breathing in the last video. So let's move on to the superficial muscles, the ones that contribute to sensation during sex. Remember, these are the muscles attaching to the connective tissue around the clitoral hood area, and they pull downwards and backwards, increasing sensitivity. So how do you find these superficial muscles? You need to be relaxed, so lying on your side or on your back are good positions. Think about your anatomy. Start at your tummy button and follow the line down to the central front section of your pubic bone. Feel down over the lower edge of this bony arch and you'll find that you land on the area just above the clitoral hood. Very gently put a little bit of pressure onto this area, pressing onto the pubic bone. So what's the best movement pattern? You need to think about trying to stop yourself having a wee. You'll feel some tightening around your back passage, but try and focus on that tightening sensation around your vagina, as if you're trying to hold a tampon in place. Can you feel a downward and backward movement under your finger? If you can, that's great. You've identified movement in these superficial muscles. If you haven't, then don't worry. There are ways to encourage these muscles to move, and we'll cover that when we focus on fit clit exercises. Don't worry if you're not experiencing a big movement. Just keep practicing a few contractions over a few days until you're able to do the movement more easily. Remember, we're not aiming at just waking up your pelvic floor, but also that the part of your brain that sends instructions down to the area. We're going to go into more details about pelvic floor exercises along with relax and release techniques in the final video of the programme. Now, women often lose heart because all they can feel is a flickering movement, or perhaps they feel they can just about hang on to the hold, but when they release, the muscle's already faded out. Or no matter how hard they try to find the muscle, the brain just can't find it at all. Finally, sometimes it's just a struggle mastering the correct technique, and any attempt always finishes up in a bearing down movement, and we don't want that. So this is when using a muscle stimulating device with a vaginal electrode can be really helpful as a way of kick-starting and supplementing a pelvic floor exercise routine. You might be thinking, how on earth can one set of muscles improve all these different symptoms? Overactive bladder, stress incontinence, poor sensation? Well, it's one group of muscles with different roles, and that can be really confusing. So I'm hoping this summary of the S's will be helpful. Firstly, engaging and waking up your pelvic floor can help to switch off that oversensitive bladder emptying reflex. Shut the doors, closing off the bladder outlet to reduce stress incontinence leaks. 30% of your pelvic floor muscles firing fast and furious when we cough and sneeze, and they're called the fast twitch fibres. Then their support. The muscles and the connective tissue keep the bladder and pelvic organs in a protected position to make them less vulnerable to pressure from above. So you need a chunky set of muscles that give a firm foundation, muscles that can work for long periods without tiring. These marathon fibres make up 70% of your pelvic floor, and they're called slow twitch fibres. There's a lot going on during these intimate times, and pelvic floor muscles are a key player in the orgasmic response. At the peak of pleasure, the muscles surrounding the vagina, the clitoris and the anus all contract rhythmically, creating a sensation that spreads through the pelvis. So strong pelvic floor muscles can result in a more intense, powerful orgasm. The key to success is being able to plan a progressive exercise routine for your deep muscles, increase your awareness and activate those superficial sex muscles with fit clit exercises, fully release and relax your pelvic floor, and last but not least, stick to the DIY program that you set in place. The relaxed release, onwards and upwards video will give you all the details you need to set up a DIY pelvic floor program. So top tips to finish off: don't stop and start the flow of urine when you're having a wee. It's not a good way to exercise your pelvic floor muscles. And definitely don't be a hoverer. When you pass urine, sit down on the toilet. A quick win: if you feel a cough or a sneeze coming on, or you're going to do a movement that you know you usually leak, do a firm pelvic floor muscle contraction. It's called the Knack, and it can work really well even if you're just starting out with your muscle training. Our last myth buster in this section is one I've heard a lot. Women who say, I should have started these exercises years ago after I'd had my baby. It's my fault. Well, the answer is no, it's not. We all have different life experiences, whether that's of childbirth, menopause, intimate relationships, and just general health. So blaming yourself is never helpful or correct. Plus, it's never too late to start caring for your pelvic health. And muscles strengthen whether you're 18 or 80. If you're thinking, I don't know what to do because I have an overactive bladder and stress leaks, the advice would be focus on the most bothersome symptoms first.